वेलकम फ्रेंड्स, आज हम लोग सीरम प्रोटीन इलेक्ट्रोफोरेसिस के बारे में समझेंगे और देखेंगे कि ये कब जरूरी रहता है ये टेस्ट करवाना। चलिए देखते हैं। इलेक्ट्रोफोरेसिस ऑफ सीरम एंड हीमोग्लोबिन इज डन टू डायग्नोज वेरियस डिजीज एंड दैट ऑफ सीरम एंजाइम फॉर स्टडिंग आइसो एंजाइम्स ऑफ सेवरल एंजाइम्स फॉर डायग्नोसिस ऑफ डिजीजेस। तो सीरम और हीमोग्लोबिन का इलेक्ट्रोफोरेसिस करते हैं तो क्यों? तो डिजीज़ को डायग्नोज करने के लिए, या फिर सीरम में कौन कौन सा एंजाइम है या आइसो एंजाइम है उसको डायग्नोज करने के लिए। फॉर एग्जांपल, इलेक्ट्रोफोरेटिक पैटर्न ऑफ सीरम लैक्टेट डिहाइड्रोजिनेज हेल्प्स टू डायग्नोज इफ द पेशेंट इज सफरिंग फ्रॉम मायोकार्डियल इन्फार्क्शन और लिवर डिजीज। लैक्टेट डिहाइड्रोजिनेज ना, इंक्रीज इन LD1 लैक्टेट डिहाइड्रोजिनेज 1 बैंड, ये बैंड बढ़ा हुआ है, इंक्रीज मिल रहा है, सिग्निफाइज कार्डियक ओरिजिन ऑफ LDH एंड इंक्रीज इन LD5 पॉइंट टू लिवर डिजीज। सिमिलरली, isoenzyme pattern of serum alkaline phosphatase helps differentiates between source of increase of this enzyme in blood between bone, intestine और other tissues। सिमिलरली यानी कि इसी तरह से आइसोएंजाइम पैटर्न जो रहता है सीरम अल्कलाइन फॉस्फेटेज का, वो हमें मदद करता है हेल्प डिफ्रेंशिएट बिटवीन सोर्स ऑफ इंक्रीज ऑफ दिस एंजाइम इन ब्लड, जैसे कि बोन हो गया, इंटेस्टाइन हो गया या फिर अदर कोई टिश्यू हो गया। इलेक्ट्रोफोरेसिस इज ऑल्सो एम्प्लॉयड फॉर प्यूरिफिकेशन ऑफ सब्सटेंसेस फ्रॉम कॉम्प्लेक्स बायोलॉजिकल फ्लूइड। Electrophoresis is a method by which electrically charged particles of a mixture of substances are separated in an electric field. Electrophoresis is a method by which electrically charged particle। इलेक्ट्रोफोरेसिस में क्या होता है? तो एक तरीका है जिसमें कि इलेक्ट्रिकली चार्ज जो पार्टिकल होते हैं मिक्सचर में ऑफ ए मिक्सचर ऑफ सब्सटेंसेस आर सेपरेटेड, वो सेपरेट होते हैं इन ए इलेक्ट्रिक फील्ड। The positively charged particle migrates towards cathode and the negative charged particle towards anode। The positive charge cathode की हो जाता है और negative charge anode की तरफ। The rate of migration of similarly charged particle will depends upon among other things such as shape, size etc. of particle। shape में भी डिपेंड करता है, साइज पे भी। On the number of charges each particle carries और चार्ज पे भी डिपेंड करता है। As a result of different rates of migration, a mixture of proteins such as plasma can be separated into a number of fractions having different mobilities। इसका परिणाम क्या होता है? As a result of different rate of migration, a mixture of protein such as plasma can be separated, वो सब सेपरेट हो जाते हैं अलग अलग प्रोटीन्स जो होते हैं, into a number of fraction having different mobility। First electrophoresis was done in a fluid electrolyte by Tiselius in 1937। In this method, the differently charged particle move inside the buffer। वो बफर के अंदर में मूव किए, डिफरेंटली चार्ज पार्टिकल जो है वो मूव किए इनसाइड द बफर। दिस मेथड वाज कॉल्ड मूविंग बाउंड्री इलेक्ट्रोफोरेसिस। मूविंग बाउंड्री इलेक्ट्रोफोरेसिस बिकॉज ऑफ इट्स कॉस्ट एंड कॉम्प्लिकेटेड apparatus, this method has been used by only few workers। Constance Jordan Martin in 1946 introduced filter paper as a support to hold the electrolyte in the electrophoretic technique। Thus paper electrophoresis made the technique simpler। Filter paper was the first anti-convection medium to be widely used। Later on, other media such as cellulose acetate, agar gel, starch block and acrylamide gel have been used in place of paper with better results। Paper electrophoresis principle: a small amount of serum is applied on a Wattman number 1 filter paper strip previously soaked in buffer solution, the two ends of which dip in two compartments of an electrophoresis tank containing the buffer solution। paper electrophoresis principle. A small amount of serum is applied. A small amount of serum is applied on what means number 1 filter paper strip previously soaked in buffer solution, the two end of which dip in two compartments of a electrophoretic tank containing the buffer solution. An electric potential of direct current is applied to the ends of the paper for a desired period. During this time, different fractions of the protein mixture separate into discrete bands depending upon the amount of charge, the shape and the size of the protein particle. At the end, electric current is disconnected. Paper is removed from the tank, dried and stained with a protein stain to demonstrate different protein bands. The fastest band is albumin. Behind it are alpha 1 globulin, alpha 2 globulin, beta 1 globulin, beta 2 globulin and gamma globulin in that order. The stained electrophoretic can be subjected to quantitation of different fractions either by direct scanning in a photoelectric scanner or by elution of different bands in suitable solvent and measuring the eluted color in a colorimeter. Basically, two types of electrophoretic tanks are available: verticals and horizontal. Verticals and horizontal. Basically, two types of electrophoretic tanks are available: vertical and horizontal. In both types, there are 5 compartments. The electrodes are present in two outermost compartments, which is connected to adjoining compartment by wicks. By this arrangement, the pH change occurring in the electrode compartments is prevented from affecting the adjoining compartments. In which the ends of the paper dip. In the middle, there is a central compartment in which the ends of the paper dip. Okay, in the middle there is a central compartment. The arrangement is shown in figure 338. Okay, 38 figure में दिखाया गया है. Buffer is filled. Buffer is filled in all compartments except the central one. Buffer is filled in all compartments except the central one. In vertical type paper is kept in vertical position, while in horizontal type it is kept in horizontal position. Reagent buffer pH 8.6, ionic strength 0.083 mole, molarity, dissolve 3.12 gram of diethyl barbituric acid and 17.1 gram of sodium diethyl barbiturate in water. 3.12 ग्राम डाइथाइल बारबिट्रिक एसिड लेंगे और 17.1 ग्राम ऑफ सोडियम डाइथाइल बारबिट्रेट इन वाटर एंड मेक अप टू 1 लीटर. इसको 1 लीटर बना देना. ड्राई सॉल्यूशन 825 ml of 95% ethanol to 0.10 gram of bromophenol blue and 0.50 gram of zinc sulfate ZnSO4. 7H2O. Mix well. Add 5% volume by volume acetic acid. Mix the dissolve and make up to a liter with further 5% acetic acid. Wash solution. ड्राई सोल्यूशन में क्या है 25 ml 95% इथेनॉल लेंगे to 0.10 gram of bromophenol blue and 0.50 gram of zinc sulfate ZnSO4 7H2O. मिक्स करना है, मिक्स वेल, एड 5% वॉल्यूम बाय वॉल्यूम एसिटिक एसिड, मिक्स टू डिजॉल्व एंड मेक अप टू a liter with further 5% acetic acid. फिर है वॉश सॉल्यूशन, एसिटिक एसिड 5% वॉल्यूम बाय वॉल्यूम. फॉर फिक्सेटिव सॉल्यूशन, एसिटिक एसिड 5% वॉल्यूम बाय वॉल्यूम कंटेनिंग 0.3% ऑफ सोडियम एसिटेट. वॉश सॉल्यूशन में एसिटिक एसिड रहेगा 5% वॉल्यूम बाय वॉल्यूम. फिक्सेटिव सॉल्यूशन जो है एसिटिक एसिड रहेगा 5% वॉल्यूम बाय वॉल्यूम कंटेनिंग 0.3% ऑफ सोडियम एसिटेट CH3COO and 3H2O. फिक्सेटिव सॉल्यूशन. प्रोसीजर कैसे कैसे क्या करते हैं, तो देयर आर सम वेरिएशंस इन द डिटेल्स ऑफ द प्रोसीजर adopted by different workers. Pour sufficient buffer into the 4 compartments up to the same level, leaving the center compartment empty. Cut Wattman number 1 or 3 mm paper into strips of 35 cm long or as suggested by the maker of the instrument and 5 cm wide. Mark the center of the strip with a pencil and make the point of application of sample by another line 2.5 cm in length parallel to and 5 cm from the midline for the vertical tank or 2.5 cm away from the midline for the horizontal tank. मार्किंग कैसे करना है देख लेते हैं. मार्क द सेंटर ऑफ द स्ट्रिप विथ ए पेंसिल and make the point of application of sample by another line 2.5 cm in length parallel to and 5 cm from the midline for the vertical tank or 2.5 cm away from the midline for horizontal tank. Now apply the paper in such a way that the 2 ends of the paper dip in the 2 buffer compartments adjoining the electrode compartment. Replace the lid of the tank. In about 2 hour time, the whole paper gets soaked with the buffer. Now apply 10 microliter of the serum or plasma by a micropipette on the line marker for the sample application. It may be necessary to lift the paper for serum application in the case of vertical tank. Replace the paper in its place and cover the tank. At a time, several such strips can be set up for different sample. Now connect one electrode with cathode and other with the anode for the paper or power pack supplying direct current at constant voltage and constant amperage. The electrode nearer the site of serum application is connected to the cathode. Switch on the current and allow the electrophoresis to run for 15 to 18 hours. The voltage gradient of 3.2 volt per centimeter length of the paper or a current of 1.5 to 2 milliampere for each 5 cm wide strip is suitable. At the end of the desired length of time, first disconnect the instrument from the main, remove the strip from the tank and dry it at 100 to 110 degrees Celsius for 30 minutes, preferably in a forced draught oven. Staining. Pour sufficient stain in a large size glass or enamel tray and put the dried paper strip in it for at least 6 hours. Overnight staining is preferable. Pour sufficient stain in a large size glass or enamel tray and put the dried paper strip in it for at least 6 hours. Overnight stain is preferable. After removing from staining tray, wash for 7 minutes each time in 2 changes of wash solution. Then in the fixative solution for a further 6 minutes. Dry the paper in air or in a in an oven at 100 to 110 degrees Celsius. After staining, one will notice 5 bands corresponding to albumin, alpha 1, alpha 2, beta 1, beta 2, and gamma globulin. It is possible to note from the electrophotogram if some protein fraction is absent, present in decreased or increased amount, or some extra band such as of myeloma protein is present. However, the relative amount of different fraction can be accurately estimated by directly staining the paper under photoelectric scanner. Alternatively, different bands are cut and eluted in 6 ml of normal 100 NaOH for 30 minutes. Then these eluted colored solutions are read in a photoelectric colorimeter at 540 nanometer. Electrophoretic pattern changes in some conditions. Albumin 3.5 to 5.5, globule alpha 1 0.1 to 0.4, alpha 2 0.4 to 0.8, beta 0.5 to 1, and gamma 0.7 to 1.5. Infancy normal, alpha 1 high, alpha 2 high, beta or gamma normal, no change. Pregnancy albumin low, alpha 1 high, alpha 2 high, beta high, normal. Acute infection albumin no change, alpha 1 high, alpha 2 high, beta no change, gamma no change. Chronic infection albumin low, chronic infection albumin low, alpha 1 globulin high, alpha 2 globulin high, beta globulin no change, gamma globulin high. Cirrhosis albumin low, alpha 1 globulin high, alpha 2 globulin no change, beta globulin no change, gamma globulin high. Nephrotic syndrome albumin low, alpha 1 globulin high, alpha 2 globulin very high, beta globulin no change, gamma globulin low. Myelomatosis albumin no change, beta alpha 1 alpha 2 beta no change, gamma globulin very high. Separate band occasionally seen in alpha or beta position. Hypogammaglobulinemia, very low gamma globulin, and albumin alpha 1, alpha 2, and beta subnormal. Agarose gel electrophoresis. Agarose gel has been in use for quite a number of years and is the most widely used material for electrophoresis. Agar gel has the advantage of a low absorption of proteins with resulting well-defined bands. Agarose gel has been in use for quite a number of years and is the most widely used material for electrophoresis. Agar gel has the advantage of a low absorption of protein with resulting well-defined bands. Unlike paper electrophoresis, protein separates into 6 distinct bands: albumin alpha 1, alpha 2, beta 1, beta 2, and gamma globulin. We shall describe here the procedure for serum protein electrophoresis. Reagent preparation of gel. A 1% solution of agar is prepared for electrophoresis in buffer solution. Microscopic glass slides are used for preparing the agar plates, and approximately 2 ml of prepared agarose is required per slide. Wait out 20 mg of electrophoresis grade agar in a boiling tube and add 3 ml of barbitone buffer to dissolve heat in a bacteriological steamer or on a boiling water bath for an hour with shaking every 10 minutes. Place the clean microscopic slide on a level surface using a pre-warmed fast delivery pipette. Layer 2 ml of molten agar on each slide. Allow to set and store in a moist chamber at room temperature. Buffer, यह barbiturate buffer pH 8.6 has been most used. Dissolve 1.84 gram of barbituric acid and 10.3 gram of sodium barbitonic in 800 ml of distilled water. Make up to 1 liter with distilled water. Check that the pH is 8.6 using pH meter or narrow range pH paper. Indicator solution. Dissolve 100 mg of bromphenol blue dye powder in 5 ml of 0.9% sodium chloride. Store in an airtight bottle. Dissolve 100 mg of bromphenol blue dye powder in 5 ml of 0.9% sodium chloride. Store in an airtight bottle. Bromphenol blue dye powder 5 ml of 0.5% sodium chloride. 100 मिलीग्राम लेना है ब्रोमोफेनॉल ब्लू डाई पाउडर और 5 ml लेना 100 मिलीग्राम लेना है और ये 5 ml. Store in an airtight bottle. Dye for staining amidose charge 10B has been almost exclusively used. Dissolve 5 gram in a liter of distilled water containing 50 gram of mercury chloride. 5 gram in a liter of distilled water containing 50 gram of mercury chloride and 50 ml of glacial acetic acid. Filter before using. Procedure क्या है? Mix 50 microliter of serum to be tested with 25 microliter of bromophenol blue indicator solution. (25 microliter of bromophenol blue indicator solution. Cut a 5 mm slot across the middle of the slide towards one end of the slide. Okay, mix 50 microliter of serum to be tested with 25 microliter of bromophenol blue indicator solution. माइक्रोलीटर सीरम लिया, 25 माइक्रोलीटर ब्रोमोफेनॉल ब्लू इंडिकेटर सोल्यूशन लिया, दोनों को मिक्स कर दिया. कट या 5 mm स्लॉट अक्रॉस द मिडिल ऑफ द स्लाइड टुवर्ड्स वन एंड ऑफ द स्लाइड. अप्लाई approx 2 microliter of the serum dye mixture to the slot using a capillary tube. Lay the slide on the electrophoresis apparatus and place the shock filter paper on both ends of the slide. Remember that at alkaline pH all proteins are negatively charged. Therefore, the sample end of the slide should be towards the cathode side of the tray. And the protein sample will migrate towards anode end. Using a constant current setting, apply a voltage of 120 volt, adjusting the current to 7 milliampere per slide. Be careful not to allow the dye front to cross the end of the slide. After the run, switch off the current, remove the slide and place in cold dilute acid ethanol water acetic acid 70:25:5 volume by volume for 30 minutes. Then dehydrate by immersing in 90% volume by volume acetone water for 4 hours. It can also be left overnight. Finally, dry in a incubator at 37 degrees Celsius. After the slide has completely dried, immerse it in the amidose charge 10 for 30 minutes. Then wash by immersing 3 times in fresh proportion of 2% volume by volume acetic acid for 5 minutes. Rinse for 5 minutes in water and dry at 37 degrees Celsius. This technique would separate protein into albumin, alpha 1, alpha 2, beta 1, beta 2, and gamma globulin. Albumin, alpha 1, alpha 2, beta, and gamma. The main components of the different bands are albumin, largest fraction, alpha 1 globulin, mainly composed of alpha 1 antitrypsin, alpha 1 lipoprotein, alpha 1 acid glycoprotein, alpha 2 globulin, alpha 2 macroglobulin, haptoglobulin, beta 1 globulin, transferrin, beta 2 globulin, complement factor 3, beta 2 lipoprotein, gamma globulin, various fraction IgG, IgE, IgM, IgD, and IgE. Serum protein electrophoresis, hydrogel, aerosol. Serum protein are separated into 6 groups: albumin, alpha 1 globulin, alpha 2, beta 1 globulin, beta 1 globulin, beta 1 globulin, beta 2 globulin होना चाहिए ना, फिर गामा ग्लोबुलिन, माइलोमा बैंड, beta 1, beta 2. ओके फ्रेंड्स, चैप्टर 31 कंप्लीट हो चुका है। मिलते हैं नेक्स्ट वीडियो में चैप्टर नंबर 32, पेपर क्रोमेटोग्राफी एंड 3 लेयर क्रोमेटोग्राफी। तब तक के लिए बाय। हंसते रहिए, मुस्कुराते रहिए और पढ़ाई करते रहिए। बाय बाय।